Hello everyone, and welcome on this World Evidence-Based Healthcare Day. I'd like to welcome you all to our webinar, Getting Evidence into Policy and Practice, the Deeble Scholar Perspective. My name is Rebecca Haddock and I'm the Director of the Deeble Institute for Health Policy Research at the Australian Healthcare and Hospitals Association. Before I introduce you to our scholars, I would like to first acknowledge that I am joining you from the lands of the Ngunnawal people and pay my respects to their elders past, present and future. So for those of you who aren't so familiar with the Australian Healthcare and Hospitals Association, we are the national peak body for public hospitals and not-for-profit healthcare. In addition to our policy and advocacy work within the AHHA, we have our Centre for Practice, the Australian Centre for Value-Based Healthcare, and our research arm, the Deeble Institute for Health Policy Research, through which we run the scholarships program. The scholarships are typically aimed at high achieving PhD students and early career researchers, but we also accept applications from medical students and junior policy staff from our member organisations. We have two types of scholarships available: the Jeff Cheverton Memorial Scholarship, which focuses on issues of primary health, mental health, aged care, Aboriginal and Torres Strait Islander health, and LGBTQI health. This scholarship is sponsored by Brisbane North PHN and Northwestern PHN. Our other scholarship that is available is the Deeble Summer Scholarship, which is open to all areas of health services and systems research. And this scholarship is supported by HESTA. The program itself is a 6-week program, starting off in week 1 with a workshop on how to write for policymakers. This week is really spent around developing the key policy messages. Week 2 and week 3 is where we start to engage with policymakers in order to best inform the development of our policy briefs. Week 4 and week 5 are around gathering and analysing and synthesising the evidence, and hopefully by week 6 we will have a final draft of the issues brief. But I'd like to reassure you all that the program doesn't just end there, and you're actually mentored until publication, at which point the paper is disseminated broadly through our networks. We reach out to the media and we target decision makers in particular. So on that note, I'm really, really proud to introduce the Deeble Scholars to you. First off, I'd like to introduce Dr. Michaela Jorgensen, who is Assistant Director of Research at the NDIS Quality and Safeguards Commission. And Michaela was one of the first scholars that I ever had the pleasure of mentoring. Miss Samantha Prime, who's a research fellow at the Faculty of Health at the University of Plymouth in the UK, and it's midnight over there and she's kindly joining us from abroad. Dr. Mia Raja, who's a research associate and occupational therapist at Flinders University, and Dr. Sean Docking, who's a research fellow in epidemiology at Cabrini Health in Melbourne. So thank you all for joining me today. I would like to start by first asking you all to tell us a little bit about the issue you came to the Deeble Institute to explore and what the impact or outcome of that paper was. So Michaela, I'd actually like to kick off with you. Would you like to tell our audience today a little bit about why you came to the Deeble Institute and what the outcome of your work was?
Yeah, well, actually my previous supervisor at Macquarie University had been involved with the Deeble Institute and encouraged me to apply. So that's how I kind of heard about it. I've never had a big kind of career plan or anything like that. So I've always just kind of found my way on the encouragement of other people and experiences that seem like there might be an opportunity to make a difference. So that's how I kind of came across it in the original place. My brief in particular was looking at home care packages. So that's a type of aged care that people with complex needs receive at home. There's often a lot of attention on residential care or nursing homes, but there's a growing number of people in home care. And in particular, my brief was around looking at the evidence around a series of policy reforms over the last decade that have made changes to the home care system for older people. So we're sort of looking at what is the evidence that had been effective and for who. And I wanted to look at that from different perspectives. So what has been done to evaluate the reforms at a kind of system level, who was looking at the workforce, what impacts have the home care reforms had on older people themselves, obviously. And as a data analyst, I was particularly keen on looking at how big data could be a piece of that puzzle. So what questions could be answered about the effectiveness of home care reforms with existing data and what were the gaps and those sorts of things. Just in terms of impact, I think that our brief had a number of impacts at kind of different levels, and that was really thanks to the Deeble and the opportunities that Deeble and AHHA sort of brought. So when my brief came out, I had a bit of interest from kind of senatorial staff and the aged care minister's office, and I was able to speak to them about my brief and the recommendations, which was really, really good. I did a couple of interviews with particularly the aged care media, and I was able to share recommendations like with some key people at the Department of Health, peak bodies, and the brief had been cited since then by some of the peak bodies in consultations to government and things like that. So that was really important. And I hope that kind of jointly, all those effects together have had at least some impact on pressure around reducing the home care waiting list, which is a big problem. And then I was just going to add as well, just in terms of impact on me personally in the shape of my career, I think it really has allowed me to establish connections with other researchers in the field. And interestingly enough, someone just last week had read my brief, which is now 3 years old, and contacted me to have a chat with them about it. So I think that was really, really wide-ranging and different impacts from the brief.
Thanks, Samantha. Sorry, Michaela, Samantha, you're next. Sam, would you like to tell us a little bit about your experience?
Yeah, absolutely. So I came to the program having heard about it from colleagues at OSHI at QUT who had also been through the program, but inherently really motivated towards trying to sort of shape the policies that naturally guide the way that patients move throughout the healthcare system. And so I looked at specialist referral reforms with my co-authors, and naturally referrals are something that touches everyone throughout the health system, millions of people on a daily, weekly basis, but it's something that has had very little scrutiny since it was conceived actually back when Medicare was formed in the 70s. And so the process that I went through as a curious individual was to say, you know, I had witnessed in my clinical role and my research that I was doing at the Children's Hospital, patients who were referred on an ongoing basis. They were coming through flagged as a new referral. In fact, they had chronic conditions, and that the process of having a new referral piqued that curiosity of saying, well, there's nothing new about this. They have been unwell for a long period of time. They will require long-term specialist care. So what is this system in place where they have to go back and get a repeat referral from their GP for the purposes of maintaining access to the care that they need? And so that no one was able to answer those kinds of questions. And so that unpacked my desire to want to explore this a little bit further. And referrals in the Australian system have an inherent time frame attached to them. They can be indefinite, but that's infrequently applied. And so this means that referrals that often expire, if it's a specialist to specialist referral, after 3 months, means it prompts that patient to go back to the GP purely for an administrative consultation, even though their specialist needs remain the same. Often GP-led referrals expire after 12 months as well. And similarly, even though their needs are long-term, the point of having to go back for that administrative consultation is a very low value activity. And so unpacking that was quite an interesting one because there was an absolute absence of I guess, literature on the topic. It hadn't been scrutinized, and so you had to really dig deep in the policy to try and understand the rationale, but there's a lot of competing stakeholder interests in all of these things as well. And so trying to map out a really clear, concise argument of why we really need to have this reform, because it's very inefficient way to structure our health system, and the burdens on patients are quite immense, but they're very hidden because we don't record it and capture it at all. In terms of the impacts of it, I think with all policy, it's a marathon. So, there hopefully some long-term impacts we'll have, and we'll keep sort of pushing the narrative as well. And that's a big benefit of working with the AHHA as part of this Deeble program, is that you're backed by a group of people who are really motivated for that long-term journey, because it is a big uphill push. But immediate impacts were quite interesting. We decided to publish the brief the same time as a conversation article. It was very topical, related to something within the COVID referral pathways, and so we linked it to that and timed it to be released at the same day, and that generated a lot of chatter, which was fabulous. And that's, I guess, what you want. You want to have those conversations, right? Ruffled a few feathers, absolutely. And it's good to know that you've backed yourself in that journey, because you know it in and out. And it's interesting in this policy space that you soon realize that you really do become the expert in the room, because it's a dense topic, and not a lot of people have the time, politicians included, to spend days, weeks, months going through the intricacies of policy and context. And so it's interesting. He has lots of radio interviews in the back of a COVID van, as I was working at the time in North Queensland as running a mobile COVID testing facility, and was perhaps not prepared, should have had the day off work. But sitting in the back of that van and giving a whole heap of interviews was quite interesting, very hot, but it was good. And so we had a lot of uptake as well, and interest from other peak bodies trying to push this, representatives and different sides, clinicians as well, coming forward saying, yep, absolutely, we see this as a problem, want to push for change. And so it was positive. I think there's lots of diverse perspectives out there, but just trying to push the narrative along.
Samantha, can you just comment with the accompanying conversation article, how many comments did that actually generate?
Yeah, so I did a little bit of a snapshot analysis of it within the month following. It was initial conversations, the comments were probably within the first couple of days, up to in excess of 1,000 comments. And so it was interesting looking through and doing some analysis of those comments, thematic analysis of whether they were predominantly patients and that patient perspective, or a clinician, the clinician perspective. Overwhelmingly from the patient perspective, it was, yes, this is an inherent issue I face, seems to be on every other month, and particularly with the increasing chronic conditions, multimorbidity, people's referrals expire sort of all over the place, and it is a lot to manage, and it is quite burdensome. On the other side of the coin, there was some interesting commentary from service providers that really held on to the narrative that it is an important thing to maintain for continuity of care, for communication between the multidisciplinary team. But at the end of the day, we're in a digital age now. The 1970s was not a very digitally diverse time, but there's no real excuse now to kind of hang on to that policy to maintain that communication and insight across the team. We can do that very effectively with digital technologies.
Thanks, Samantha. Mia, do you want to tell us a bit about your experience?
Sure. Oh, sorry, I've just lost my lights. So I came to learn about the scholarship program actually through Michaela, who was one of our panel members. So she tweeted about it, and I saw it. So I had a look into the opportunity a bit more, and just thought I needed to apply. As a background to that, I guess, I had recently completed my PhD, which was at the end of 2019. In my PhD, I evaluated the implementation of an evidence-based occupational therapist delivered reablement program for people with dementia here in Australia. As a part of that PhD project, I completed a very thorough cost-benefit analysis that's quite familiar with policymakers, and that analysis showed that the program could reduce societal and economic impact of dementia in Australia through just a reduction in healthcare service use and informal care burden, that dementia might cause, as well as then improved quality of life for people with dementia. So until quite recently, people with dementia in Australia hadn't had opportunities to access these kinds of reablement programs that had shown to be effective in research studies. Most studies had sort of excluded people with dementia, so there were now new programs that have been developed in North America and in Europe, so we brought one of those in here. And so what happened during the implementation process was it was quite clear that funding the right kind of programs is very important, and upskilling and supporting allied health workforce to deliver these kinds of programs is really important as well. And obviously, of course, that people with dementia have access to these kinds of programs, and they are able to stay home as long as they want. So when I was completing my PhD work, I was left to think, you know, really more needs to be done to advocate for these people and to enable them to access these programs. So when I saw the scholarship opportunity come up, I just thought I needed to apply because there was much more that I could do. So that was obviously then the focus of my issues brief as well. One of the topics in the brief was, in my brief was sort of recognising dementia more as a disability than a disease of an old age, because that way people with dementia would have more opportunities for care that recognises both their health and their social needs. I also talked a lot about addressing stigma towards dementia and how we need to educate public and health professionals about the dementia and interventions that have shown to improve outcomes. So that was mainly the topic of my brief. In terms of impact, so that was only published June this year, so it's still fairly recent. I did have straight away, within 1-2 weeks, I did 4 national radio interviews, morning talk shows that I completed. In a week that my brief was published, it was one of the top 3 reports accessed via the Australian Analysis and Policy Observatory. So it sort of caught interest straight away. I think sort of longer term impact I'm still yet to see, but yeah, it's been a great experience so far, and yeah.
Mia, can you tell us a little bit about who you actually met with during your scholarship?
Yes, so I met with the Allied Health lead for, oh goodness me, you asked me a good difficult question now, Rebecca. It was Anne-Marie Boxall we met.
Health officer for the Department of Health.
Yeah, so it was Anne-Marie Boxall, we met her, and then Robert from Department of Health, we met a representative. I met with representatives from Dementia Australia. So I had a good mix of representatives who I got to meet as part of the journey that I had.
So both government decision makers, but also peak body advocates.
Yeah.
And
yeah.
Excellent. Sean, on to you. Do you want to tell us a bit about your experience?
Yeah, thank you. So coming to the scholarship, timing was key for me. I was 4 years into my first postdoc with a year left. I was towards the end of my Masters of Health Economics, and my previous PhD and postdoc were really in elite sports, so really focused on the micro level of healthcare. And in that transition, I'm not a clinician by trade, so that micro level, the impact I could actually make was probably limited, and I wanted to get into having a more macro health policy view on with my research. So I was transitioning to a new job. The scholarship came at this perfect time to actually sink my teeth into an issue that I really cared about. So the issue that my policy brief was around diagnostic errors related to medical imaging. So in Australia, it's estimated that 140,000 diagnostic errors occur each year. And this is a particularly concern to the medical imaging sector because their primary role in the health system is assisting in providing an accurate diagnosis. The policy brief focused around what had what was the policy landscape in Australia in the past 10 years. And there had been significant investment in diagnostic imaging, mainly around improving access, especially to the newer imaging modalities. And what we soon realised was there was actually probably a lack of evidence that these policies actually improve the diagnostic process, and maybe even a little bit of evidence to suggest that inadvertently these policies might have contributed to increasing the number of diagnostic errors. So from that, we were able to have a couple of recommendations, mainly around the need to better identify and collect information on the diagnostic errors that do occur in the Australian system. We don't have any real good mechanisms to mention that, to measure that. And also with getting an idea of what was going on in the Australian health policy landscape, we were able to suggest some recommendations where there was opportunities already present. So the push to move diagnostic imaging services onto My Health Record to improve communication, that was a recommendation that we sort of supported to help facilitate that communication and reduce the number of diagnostic errors. And so the brief was published, I think, a month and a half ago. I was a bit slack after doing the 4 week, a small portion of the scholarship. And the immediate impact was, firstly, from two of our government stakeholders, we received feedback about how they really valued the resource, and it was going to be very important for them, for their work in this space regarding diagnostic errors, which was, I don't think I could have asked for a better impact than that. The readership and the people who were reading it were a combination of government, but also surprisingly medical indemnity insurers. That was a big interest for us, which was quite surprising. And the other sort of immediate impact was the issues brief was distributed by the Commission of Safety and Quality in Healthcare. So that just all helps to get the brief and our work out there. So that, yeah, thank you.
Thanks, Sean. Sean, you mentioned that you are only with us for a portion of the scholarship because you took up a new postdoc during the time you're with us. How did you find managing the program, given that you didn't spend the full 6 weeks embedded in the work?
Yeah, it came with its own challenges. As you mentioned, I negotiated with my new job because everything was overlapping, and I had to go to them and sell them what the benefits were. And thankfully, at the end of it, those benefits were very clear to them, so they were actually appreciative. But I did the first 4 weeks, which were, I think, the bare minimum. This is one of the things with those 4 weeks is very rarely, and especially for postdocs, very rarely do you get the opportunity to focus on one thing. You're often trying to juggle numerous projects. You might be supervising students. You're across a couple of different things. But in that 4 weeks, I felt like I needed that time to have a single focus to get across the health policy landscape, think a bit more about what my recommendations and where I wanted to go with the issues brief. Certainly, not having those extra 2 weeks after delayed my completing the brief, because back to the new job, back to having multiple focuses, and didn't really have the space to write on it. But yeah, it did make for a challenge. But I think if you are going to do that, if people decide to do the short 4 weeks, they have to make it's their sole focus. You can't jump in and out.
Thanks, Sean. So with that, I'd love to hear from any of the panelists around what they found as the hardest experience as part of, what was the hardest thing about the program. Samantha, do you want to kick off?
Yeah, I'll jump in the deep end. So hardest things. other than the fact that we did it during the worst bushfires and then the start of a pandemic, so that was really interesting. But it, policy, is made in all kinds of environments, so that was really interesting to be involved in that, and the access to different, I guess, decision makers, people, the different stakeholders that we wanted to engage with during that process, and people's, I guess, opportunity to participate. It was quite drastically split with a new emerging priority, but everyone was well engaged. That was fabulous. I think a difficulty was probably for me a couple of things. It was definitely doing a policy brief on a topic of which there is just no literature or no evidence is a really challenging thing, because there's very little to draw on, and so you have to cast your net wide. In policy, the language is so unique, and so digging deep into the Hansards is quite an interesting experience. And I'm fortunate to have Christy Gardner, who was the legal expert who co-authored that with us as well, and sort of Rebecca brought that kind of policy prowess of how to shape it. And so just trying to really weave that narrative in the absence of anything. And I think, Sean, you're right, having that 4 weeks to do nothing else is absolutely key, because it gives you that opportunity to really to dig into everything. And another challenge is just the competing stakeholder vested interests, I suppose. And it's sort of the big old elephant in the room in policy, isn't it? Because evidence-based is one thing, but then we work in a system that's very imperfect, and the Medicare system is fabulous, absolutely, but it's not perfect, and there are lots of different tensions within that space which cause it to be, I guess, people who perhaps are a little bit clouded in their judgment, and sometimes, and it's not based on patient-centered care, and so trying to subtly reinforce, or maybe sometimes with a bit of a sledgehammer, who knows, say, like, really, at the end of the day, this is about the patients, and this is about the durability of the health system. So we need to get real with ourselves, and actually not just maintain the status quo and hang on to kind of some legacy activities, and just innovate the way that we operate.
Michaela, is there anything that you found to be challenging for you as a postdoc, or something that surprised you about the experience?
Yeah, I was going to say, just continuing on from Sam, I was probably pretty naive coming into the process, as maybe some of the scholars are, but I didn't know a lot about things like the policy cycle, political context, and how policy may not always be evidence-based or not even evidence informed. So that was kind of a real eye-opener for me in the experience. I think being so I'm a data analyst, and being a kind of classic data analyst, I'm an introvert by nature, so it was difficult for me kind of putting myself out there, trying to make the most of the experience by reaching out and connecting with people wherever I can. So that was a challenge for me, but also really rewarding. So I think it has given me a lot of confidence moving forward with my career and the things that I've chosen to do with my career, particularly in terms of thinking about things like, whenever I start on a project, what are the key takeaways going to be here? How does this research fit into current policy practice? How can we try to bridge those things? I try to think about that from the beginning. So yeah, a lot of challenges, definitely balancing time away from your regular work, but having that, as other panelists have said, having that time to really get into the details of your particular area, and kind of realizing that, yeah, when you go to speak to people, you do actually know probably sometimes the most about that topic, compared to even the very important people that you speak to. So yeah, interesting and surprising experience all round.
Not that they'd ever let you know that you know more. Mia, would you like to add anything?
I think the only thing that I really have to add, and I think it probably built on a little bit of what Michaela was saying, is just coming from, completing your PhD, working in academia, and then suddenly you're writing to policy. It is quite different, and you think you've got several published articles, and then suddenly writing something like this was just quite challenging, and you really have to rethink about how you are presenting things and your ideas. So it is a challenge, but I think it's also a good challenge because, again, it shapes you and betters you when you are continuing on your professional career, applying for grants and anything else. So initially it is a challenge and a bit of a shock because you already think that you can write this sort of stuff, but when you start doing it, it's quite different.
Yeah. And for those who haven't taken part in the program yet, we are here to mentor you through that process. You're not just sort of dumped in an office and told to write. So don't think about that. Mia, what did you enjoy most about the program?
I think it was meeting with those stakeholders was great. Again, being in such an early stage of my research career post PhD, I just never really envisaged that would happen so quickly. So I think it was really great to be able to do that. But I think also like engaging with yourself, obviously, and with Deeble, learning those skills to, how can I make the work that I have done now meaningful to other people and those policymakers. I think that was really a good learning, and I really enjoyed it, and something that I've been able to sort of take with me in my what I do currently in my workplace as well. So that's been really good.
Sean, what did you enjoy most about the program?
I completely agree with Mia. It was, I think we'll all agree that the meeting with the stakeholders was nerve-wracking. It was the half an hour or the preparation before that meeting, you were just a nervous wreck. But at the end of it, it was such a brilliant experience. And for me, I was really lucky to engage with 6 or 7 different stakeholders from different clinical colleges, government, or stakeholder groups. And I still remember that some of those conversations actually helped shape the brief in so many ways. I remember we were talking to a consumer group, and their first question was, I don't get what diagnostic errors are. So for us then, it was like, okay, well, then the brief can't assume that people know what a diagnostic error is and how they occur. We actually have to walk through that, but also in other ways. I think we got the idea of some of our indicators of diagnostic error through our engagement with stakeholders. So it not only was it, I don't know of any other opportunity or scholarships where you get that opportunity to talk directly to stakeholders. So that in itself was amazing, but how giving they were with their expertise and how much that shaped my brief made it for the better. It was not like a peer review process where you're getting nasty negative comments from reviewer 2. It was actually really helpful.
And Michaela, you had a bit of a unique experience. We got to go up to Parliament and speak to people up there. Can you talk about what that was like?
That was a nerve-wracking experience, but also a very interesting experience that I don't think I otherwise would have had. So being in, waiting to see someone in kind of the Senator's office and hearing the bells of Parliament ring and everyone running off quickly to Parliament, it kind of, it made me aware of how policy is done, not I don't want to say on the run, but that you've got to make the most of kind of even 5 minutes that you might have with someone to try and advocate for your issue or the people who you're advocating for in terms of the research. So yeah, a very, very interesting experience, nerve-wracking as others have said, but and hopefully I've been able to have some impacts on kind of the lives of older people, which is kind of why we're all doing the research that we're kind of doing. So yeah, very unique.
And Michaela brings up a really good point. That's why we actually spend a good proportion of the early part of the program developing our key messages and refining what we're actually going to say to the policymakers and the other stakeholders that we, we're able to connect with. And so even though you think, key messages, a page of writing, not a problem, it's really important to craft that particular work. Michaela, what skills did you actually think you've taken away from the experience?
Definitely better communication skills. So I think I said this before, but how to kind of hone those key messages. So I think I remember in my first week coming into the program, and you were sort of saying, what are your key messages? And I'm like, I don't know what my key messages are. But you helping me craft, you and the team at Deeble helping me to craft those messages has been really influential in everything that I've done since then, I think. And it's something that I often ask my students as well. I sort of say, well, what are your key takeaways here? What are we getting at here? How can we change things? But I think also trying to understand the kind of policymaker context. So listening to what policymakers need and trying to understand where they're coming from, how it fits into their kind of cycle, or what they kind of need from researchers as well. So kind of trying to bridge those gaps. And I think Sam said something along these lines, but I think my actual researching skills beyond the peer-reviewed literature have also improved quite a lot. So where to find grey literature, policy documents, things like looking at Senate estimates as a source of data. So those kind of skills that you might not, typically develop during a PhD, the kind of grey stuff around the outside. So yeah, they're kind of my points, I think.
Samantha, what about you?
Positive take-homes and skills learned.
What have you learned?
I'm still not fabulous with my elevator pitch. I have to be honest with that. That is so important. We tend to, like in academia and everything we do, we bury the lead in our articles, and it's sort of just reframing the narrative and sort of just saying what you need to say as quickly as possible, because you may only get a minute to capture someone's attention, and people are very busy. So that has left a very indelible impression with me. I try and do that in the work. I'm not fabulous at it, but I'm trying, and I'll hopefully get better in time. Practice makes perfect, maybe. But I think the skills is quite interesting. I think it's that the broader opportunity that I feel that I can share this with my peers as well, and my colleagues, friends, whomever, is saying actually policy is something that we should all be a part of. We're all impacted by it, and we can all have a voice in shaping it as well. And you can't just take it for granted that someone else has thought of it extensively, and there's a team of people that are working on each and every policy from every angle. And so it's that sense of I guess empowerment that yes, this one little voice backed by a wonderful team and my co-authors and the institute, we're able to put this brief together which actually speaks volumes and actually speaks on a topic that impacts so many people. And really a lot of people can do that, and I think the program's fabulous in that it empowers people at a relatively junior stage in this type of career trajectory to be able to do that. And so it's left a very important impression on my, I guess, approach to everything. And certainly my new job over here in the UK is about digital health innovation, which is so important that it's evidence-based but also aligns to those local policies and practices national level as well. So my brief and my interview was actually really featured in that. I had to give a presentation on a policy related topic, and I was like, oh well, I've got a very timely one that I can just pluck out, and here you go. And so I did that, and it was fabulous. So it's relevant, across the world, and so it's really fabulous to take home.
Mia, would you like to comment on what skills you've taken away from the program?
Well, I think a lot of similar skills to what Sam and Michaela, and they've already spoken about. I think it's just that you can translate a lot of the writing, the way you give your messages out to now other audiences as well, which is really important because we do need to use that in grant writing if we want to write for conversation piece or anything like that. So I think you develop a stronger voice, I think, as part of this process. And I think one thing that probably builds on a little bit with what Sam was saying, and I noticed there was a question in a Q&A from somebody about if you have to have a well-versed topic on the issues brief. I think this was actually a recommendation from Michaela when I asked her about doing this, was if you have a topic that you're really passionate about and you want to make a change in, then that's what this is really good for, because you really get to hone into those important issues on a topic that you really care about and you want to make a difference in. So I think it's given, I guess, me a stronger voice to be able to advocate for people with dementia. So yeah.
And I've got one last question for you all before we move on to some questions from the audience. Was there anything that really surprised you about the program? Sean, do you want to kick off?
Surprised me. I think how much you have to tailor your message for your audience. That was what sort of really surprised me. I don't know how many times you commented, Rebecca, going, is this an Australian reference? Is there something more up to date? Like, it was sort of really having to hone in and tailor that message was, yeah, really quite surprising, and not something that I've done previously in my academic writing. It's sort of like, oh, well, yeah, that reference, it sort of doesn't, it can go across context. Whereas, yeah, so many times I had to go back and find references for the Australian context. Yeah, I think the other sort of surprising thing was just how difficult it was to sort of try and navigate the different aspects of government and gain that information. I had all this information about what policies were being implemented, but trying to go back and find the reasons for that the minister doesn't put a reference list in their press release. You have to sort of go back and, like Michaela said, dig into these set of estimates or Auditor General reports, all that sort of stuff. So yeah, that surprised me actually, how much almost investigative work it actually took to find that information.
What about you, Mia?
I think, yeah, I think a lot of people start specificity. So really having those clear messages, but also clear sources where you got your messages from, and being able to then relay that out in a way that makes sense also to policymakers. So I think that was quite, we write again in journals and, it's on that sort of broader topic, but this just had to be so specific constantly. And I remember you were constantly asking me, but why, but why, but why? So now when I write anything or when I talk to my students, I'm always, but why is it? So I was quite surprised by that. And I probably didn't expect it to be quite like that, but yeah.
Michaela, what about you?
Look, I think the others have kind of said it already, but yeah, it was quite different than what I thought it would be, both in terms of the opportunity to have an impact and to meet with people and all those sorts of things. But as you've kind of said, yeah, a lot of support from the team throughout the experience. So that was, I think, really key. And I think that was one of the questions that maybe came up in the Q&A. But yeah, so we weren't expected to be kind of experts when we first jumped into the process. So I think, not that I should be surprised, but the Deeble and AWHA staff were very open, willing to help. You could drop by the office anytime and, chat to them, and they were very willing to kind of take you under their wing and lead you through the process. So not that should be a surprise, but it was a welcome thing when I showed up in Canberra.
Fantastic. So we've got some questions from the audience that we might go to. So Shakira would like to know how the program went running online. So in the panelists, I believe 2 of you were able to complete the program face to face. Who did the program online? Was that just you, Sean?
And me.
And you, Mia. So we managed to get, I remember sitting in the office with Samantha as the bushfire smoke was coming through the window, looking at Twitter, watching something going on in Wuhan. So I definitely know you were in the office. Mia and Sean, do you want to comment on what the program was like online? And also, one question that I've often had for me was, were the scholars able to connect doing the program online?
Yeah, do you want me to start, Sean?
Go for it.
Yeah, so it did work well. So we had set meetings. I mean, personally, I always prefer to do things face to face. So when I first learned that it was going to be online, I have to admit I was a little bit disappointed. But when we started going, it actually wasn't really an issue. So we had regular meetings that we'd set out, and then all of scholars, we actually had another little teams meeting. So we would often do like daily debriefs. So we would catch up at the end of the day without Rebecca or any of the other staff, and just kind of had a little session where we could just debrief and have those more casual chats. So we felt a bit more connected. Doing the program itself, I think my one piece of advice, if it was running online again, would be not to do it from your usual workplace, but actually stay at home and work from home when you are doing it, because I felt that if I was in my usual workplace, even though they knew that I was dedicating my time for this one, people would expect me to do work, other things. So that was probably my one thing, that I would just stay at home, do it from home, and just focus on doing this. And people would not come and bother me about other work-related issues.
Yeah, I agree with Mia. It's I'm in Melbourne, so going into work at that time wasn't an option. So having that space to do it online was really important. I think if you have to be outgoing. There are all these opportunities to communicate, even though it was online. So as Mia said, we had regular meetings with Rebecca. There's also teams set up. So the great thing was, instead of me just walking down the hall and knocking on Rebecca's office to chat to her, I could just chat into Teams, and invariably it would be like a simple note into Teams, and it's like, let's just call and talk about it. So we're lucky in the age that we're in that these opportunities are still available, just in a different forum. And yeah, I didn't feel like I was, it is a product of the situation, but I didn't feel like I got less of an experience, because I think for most of our stakeholder meetings, they were probably going to be online anyway, even if I was in Canberra. So I didn't feel like I lost out many on that. But I think, yeah, just having that support of other Deeble scholars, I think the fact that Mia and Michelle and we had our conversations just to go, oh my God, I'm so nervous about meeting the stakeholder this week, and just being able to have that support. And even for myself, even in applying and doing the scholarship, I was moving to a job with a previous scholar in John Fu. And he was really supportive in being able to sort of walk me through different aspects. So I think it is nice to do this, because I think the Deeble Scholars alumni are quite a supportive group, and I'm sure any of us are happy to help in any way we can.
Another question is around how you felt the scholarship process added value to your area of research. Samantha, your Deeble brief was quite different to where you're working right now. Do you want to talk about, were there transferable skills, or how do you think it added value?
Yeah, well, absolutely. I think it's layered, isn't it, the level of value with this? And so from a community's perspective, the brief itself adds value, because there was an absolute lack of anything on the topic. And so that's the foundation for which I hope future research, specifically on referrals within the Australian health system, will grow. From my research in Australia, looking at the children with chronic wet cough and how they are managed through their healthcare system, their quality of care, there's that layer as well, that it does influence that outcome, and it's shaped kind of conversations with hospitals themselves and how those processes are managed. And then moving forward, I think I mentioned before as well, in digital health innovation, it's just that next journey, isn't it? It's just a kind of a different issue. In a way, it's sort of different angle. At the end of the day, all we want to do is improve the health system, the way that patients and the public are supported. And so having that experience to look at it, tying everything we do into policy, governs everything we do, how we operate, the resources that are available to us. And so that's inherently related to my current role, and having that experience in trying to weave that narrative is incredibly important to what I'm doing now.
On a sort of similar vein, we have a question here around how much background knowledge did you actually need to come into the program. Mia, you kind of, you know, your research was around reablement for dementia, and that's what your issue brief was on. How do you feel like that supported your scholarship?
I think it did definitely help, and because I had delved into it a fair bit during my PhD, and it was an area that I was quite vested in. So I did have from the get-go that passion to keep working on it. So it did help. I knew some of the key literature. So I think or key literature, at least towards the programs and what was around out there in other countries. But yeah, then when it came to more the policy side of things in Australia, I probably wasn't quite that aware of it yet. So it was good to have at least part of the area that I was interested in have quite a solid knowledge base about it, because it meant that I was, when things were tough, I just was keen to keep going because I had that passion for it.
And what about you, Michaela? Your brief was also, you were working in aged care as well. Do you want to comment on that?
Yeah, I was working in aged care research with, and I'd done a couple of research papers on home care, but I wouldn't say that I was an expert on the topic coming in or anything like that. And I think a big part of my brief was me trying to step through the process of bringing all these disparate bits of information that I might have heard about or kind of, you know, knew a little bit about something, trying to bring all those pieces together as kind of a resource about, in my case, what had happened over several years in home care research and policy. So yeah, but kind of following the program, I definitely felt like I had a really good coverage of my topic, and I sort of became almost like a go-to person in my team about anything about aged care policy. You know, I might be able to point people in the direction of it. And I think that was also one of the reasons why I was seconded to the Aged Care Royal Commission last year to do some work for them. So, you know, that kind of broad knowledge really sets you up well, I think. So yeah.
Can I jump in there as well, Rebecca?
Sure.
Just at the other end of the spectrum, for me, I had no background knowledge of the referral system in Australia, or only observational experiences through the data that I was collecting and the participants that were coming through my research. I was screening them for eligibility, and it was based on children who were newly referred to an outpatient department. And that's my experience of seeing, oh, hold on, these children are flagged as new, but they're not, they have a chronic condition. And so I actually didn't have any insight specifically into this field whatsoever, just a curiosity that something's not quite right, and it's something that's worth exploring further.
Thanks, Samantha. Sean, did you have any comments you wanted to make on this, or is it similar?
Yeah, I think it was just, I didn't have a background in diagnostic errors at all. But it's funny that my research program, or my previous research, indirectly dealt with it. So it'd be inappropriate referrals or how we communicate imaging findings to patients. Those studies didn't have a diagnostic errors focus, but they actually are contributions to diagnostic errors. And I think the reason I went down that diagnostic errors pathway is because even though my interest is around over testing related to diagnostic imaging, there was a previous brief on reducing low value healthcare. So I think for those people who are applying, I think it's worthwhile for you to go back and see what has already been published, and making sure you're not duplicating something in a similar area.
Thanks, Sean. I think one of our final questions is around how long it actually takes to complete the brief. So the formal part of the program is 6 weeks. I mentioned in the introduction that we don't just sort of dump you at the end of the 6 weeks to finish off. Can you all comment on realistically how long it actually took you from start to finish, and if there was anything on the way that kind of put a bump in that road for you? Sean, do you, as our latest scholar, do you want to comment on that?
Yeah, I think even 6 weeks is a good time frame to get the bulk of it down. Even though I did 4 weeks and then had to go back to work life, I did try and at one point going, look, I can't just pick away at this. I've got to carve out some time, and was able to carve out probably a 2-week block to really deal with it. That will at least get you a clean first draft. So there's a decent amount of work there, but I think it's a realistic goal to try and at least get everything down the page for that first draft. And once everything's down the page, we all know from writing that editing process is a little bit easier from there.
What about you, Mia?
Yeah, 6 weeks. I had a first draft completed at the 6 weeks by then. For me, after that, it actually wasn't a very long process. I think the only sort of bumps that I had on the road was if I just had gotten too busy in my actual role. It took me a little bit longer to write my next draft, but if it wasn't for that, I probably would have had mine done within like 8 weeks, 9 weeks, something like that. So I think I was about 10-ish in the end from memory.
Samantha, what about you?
Yeah, so I was much longer. So I think the process for me was 9 months from start of the program to published output. So I think actually potentially the last week of the program as well, we went to remote, possibly. I just have this memory of, oh, the Queensland borders are going to shut down, so quickly pack your bag and get on the next flight out. And that really made a bit of a speed bump in the journey. Absolutely, relocating because of the pandemic for family support, and then going back to sort of returning to clinical work as part of the COVID sort of task force response in North Queensland. So that in itself, I mean, I'm respiratory background, so it was felt like the right thing for me to do, absolutely, to support the community in that clinical setting, but it did have a flow-on effect naturally for the brief. The really important thing is that the cycles and the timing of having that brief published and knowing what those important cycles are, and working with Rebecca and the team, they know them well. And so at least having those absolute hard deadlines of saying is we need this needs to be out before budget or before a particular known announcement of something, so that it can actually build on that the broader chatter in the region or the narrative, and actually have a bit more of an impact too. So I think trying to be flexible to work around those deadlines with the rest of life as well is the bit of the challenge, but at least it's useful to know you've got those deadlines to make it as impactful as it can be.
And Michaela, quickly from you, can you remember from your experience?
Yeah, I was a long time as well, so I was probably about 9 months. I think I did have a first draft, or at least I had everything down on the paper by the end of the 6 weeks, but the process of trying to hone those messages, feedback from Rebecca and the team, and then once you get back to kind of real life or your regular job, it is difficult to fit those things in. But I got there in the end.
Okay, so I think that draws us to the end of our time. I'm just going to share the screen one more time. So we're going to keep the scholarship program open, applications for the scholarship program open until the 31st of October. So if there are people who would like to apply, there's still an opportunity to do so. And I would also really like to thank all our panelists for their time today. I think it wasn't just a teaching experience or a learning experience for you guys, but I got to learn a lot from the process as well, and it's made me richer in my career for having done so. So thank you everyone for joining us today, and I hope to see your applications coming through soon. Thank you.
Thanks everyone. Good luck.
Thank you.
Thanks.